or any of the other viruses, so that's how they know it is a new coronavirus. We in Barbados do not yet have the capability to determine that it would be the new coronaviruses. That's why there are case definitions. So far, the case definitions that have been suggested by the Pan American Health Organization include contact with the place of origin, Wuhan, which is in Hubei province in China. So a person having traveled within the last 14 days from the place, Wuhan, presenting with symptoms of respiratory infection would be a suspected case. To actually say that that person is a case of the new coronavirus, we would have to take a sample, a nasopharyngeal and throat swab, or a sample of the sputum if they have a lower respiratory infection, and send it for testing. The testing so far cannot be done. I don't think it can be done in the region. It would have to go to CDC lab or the Canadian Public Health Lab for the genetic testing to actually determine which coronavirus it is. So at present, we are working with case definitions. For Barbados, in the port, we actually look at travel from China or a place where there have been confirmed cases. So that would include the new places where the cases have been determined.
And once you look at the person and you determine that they're suspicious, is it a situation where they have to be quarantined? What's that process?
Isolated.
So we have started that process. Persons who are coming from these regions will be identified by the immigration department, and persons with symptoms and without symptoms will be guided in 2 independent tracks. If persons come from the region without symptoms, we take their information and we have agreed to contact them on a daily basis to make sure in the next 14 days how they're doing. Persons who have symptoms, if it does come to this, will have to be directed towards the hospital. And I think that's part of our meeting tomorrow, because we want to make sure that our ability to manage that person with symptoms, that we rise to that level. Many of you know that we have a unit there that can handle highly infectious diseases, so we want to make sure that there are protocols, etc., that can guide these persons who, if they come to Barbados and present with fever, let's say at the airport, that we'll know what to do. So we have decided on a course of action. I think we have tried to sensitize port health. We are going to work with our nurses, etc., just to first identify persons who may be traveling from that region. But we firmly believe, as I said, I think the message that we want to get forward to the public is that persons who go to the regions, Wuhan City, you need to make sure that you protect yourself first, right? And be aware of your environment and follow those simple measures, and you will reduce the likelihood of you having a respiratory infection.